the idea is that, of course, we've heard the Union Health Minister JP Nadda also come give tell the entire nation that there's nothing to worry about particularly. And the idea of this show is also not to lay fear into the minds and hearts of people that are watching this and are worried about what is going to happen if they are struck with HMPV as well. We know it's quite a routine. There is no particular vaccination for it, but it's not fatal at all. Already today a case from Kolkata got discharged in itself. It got detected and discharged within 24 hours. My idea of conducting this entire discussion is to understand whether there's more than what meets the eye over here. Whether we're of course, knocking on the door could be some other, virus as well. Dr. Gilada, during the COVID-19 pandemic, we've seen the Omega strain. We spoke about the Delta strain. You and I having those discussions, when we used to work from home as well. I'm talking about mutations. I mean, we saw the flirt variant a couple of months back. We saw the Omicron variant, not as fatal as the Delta one, but these are all mutations. Now, could this mutation continue to take place in China, and maybe because of that, there's a virus transfer as well? I mean, I know I'm thinking out loud here, but am I at least looking in the right direction?
See, virus will keep on mutating, and it will be keep on coming not only from China but from all over. And in that sense, most of such viruses, zoonotic viruses, are originated from Africa, Nile belt of Africa, some of the central part of Africa. So we cannot blame any country because the virus is doing their job. Human beings are their job. But human beings, while doing their
Blame a
job in the
country.
same,
What about the WHO? I mean,
vaccine
isn't that
is
the
there.
global body, the global health body, doctor? Why is WHO silent?
No, that WHO should answer. But for me, today they are silent. They are not creating any panic. It's a good reaction of WHO. Otherwise,
Okay,
WHO
okay.
created lot, in during COVID also they created a lot of. It's a surface transmission. Newspapers were closed down because as if newspapers are going to create virus spread. So I think that way WHO is doing a good job, keeping silent. And my advice and my request to the government also, please do not go in panic mode like we have gone many times earlier. Create lot of meetings, lot of task force. You don't need. If you talk task force, you do a task force for influenza-like illness. So it's like any other influenza-like illness. So at this present mode, we should do only surveillance, and surveillance is being done, and that's very good thing. Secondly, we should develop cheap tests which are not available currently. So if you want to have a this metavirus test, that test should be affordable in 1,000, 2,000 rupees, not in 15, 20,000 rupees. So Metaplex PCR, they are very expensive. They are saying in our medicine, eyes do not see what mind does not know. So if we would not have known this, we are not seeing that. And because it's a self-limiting disease, people get 3, 4 days, they recover. By the time we think of any other test, the patient is recovered. And only if the patient is stuck for some time, then we think of many other tests. Here we do not think of those tests, and we do not do metavirus test at all.
All right, all right. Dr. Mohan, I'm going to come to you next. The Chinese Health Department has also stated that there's a cocktail that they're going through. There's a cocktail of viruses. They're talking about influenza type A, the metapneumovirus that we're talking about here, HMPV, and of course COVID-19 that we've all spoken about as well. Now, just to help the viewers for their perusal, out of this cocktail that China is talking about, what particular virus is most likely to put somebody in the hospital? What virus is most likely to put somebody in a real serious position but at home? Could you break that down for the viewers?
No, I think that would be a very difficult question to answer, to break down. So generally speaking, any viral infection will be more relatively more dangerous or more serious in patients who are having serious comorbidities or those who are already having some underlying respiratory illnesses. Because so that is one general kind of a statement. Otherwise, these days, even the coronavirus which you are seeing are the whatever you are getting are the relatively less severe ones. So influenza, we see quite a lot of influenza because now we are testing that. So in fact, influenza we are seeing more than most of them are getting cured. They are self-limiting illnesses, and we do have some medications for that also. So most of these are self-limiting. They require only symptomatic management, but a careful watch, especially in those who are at high risk. And always we identify the people who are at high risk, and that has always been done for all respiratory viral infections. So I think as long as we take care of that, we should be able to kind of triage that these are the people who are likely to be sicker. So be more careful vis-a-vis the others, the majority who are likely to be self-limiting and be okay in a few days.
All right, Dr. Gilada, I know WHO silence is not golden, and of course, we need to tread carefully in terms of understanding what, if there is something that they're trying to hide. But you're of the opinion that this step is a good step. It's not creating panic. They're taking time with their each step. They're thinking and strategizing behind each of these steps. Now, I'm going to read it out to you, because this is, of course, the Chinese Disease Control Authority that had announced on the 27th of December that it was testing and monitoring a system of pneumonia of unknown origin, and which is why I thought of ran up to the health desk in the newsroom as well and tried to understand unknown origin. Being compared with HMPV, something that was discovered in 2001. I mean, there's serious discrepancy in what they're saying and what they're showing and what we're understanding. Don't you think so?
If it's a multiplex PCR is expensive for us, it is not cheap for China also. So they must not be testing, and they thought that something suddenly people are coming up is supposed to be unknown pneumonia. But when they test and they find out that it is HMPV virus or influenza A or B or RSV or mycoplasma, they are themselves saying that there are a cocktail of virus circulating there. The major problem with China has been that they had a very long lockdown, and they suddenly opened the lockdown in a go. So a lot of infections they spread there. So, for example, for years and years, there's a flow of water. You put a block, and suddenly you open. It is bound to create flooding. So similarly, flooding has happened. And
is that the reason hospitals in China are overcrowded, doctor?
No, it's a huge population of is like 1.4 billion also in China. So if any respiratory infection is there, the person sneezes or coughs, it will spread. And there has been a kind of people's behavior in China. When you lock down people for 2 years, suddenly they were berserk. Now they don't want to take precaution. So even if the infections are being spread in a huge number, people are not taking precaution. That may be one of the reasons. But so long as they are self-limiting, they are not causing deaths, they are not causing hospital demand or ventilator demand, or then this is okay. It's okay. They will get immune, because second or subsequent infections, even with this virus, they are very, very mild.
All right, Dr. Gilada, you know what? We're going to leave this discussion right here. Many thanks to both our doctors on the panel. I'm going to give 20 seconds to both our doctors here, Dr. Mohan and Dr. Gilada. The camera is over to you. Your message to the larger nation, everybody that's watching that show. 20 seconds each. Tell us what you're thinking. What is your suggestion for everybody that's watching this? Dr. Mohan, we'll start with you.
Okay, my suggestion would be that one needs to be careful all the time, and that goes at all points of time. So respiratory viruses, anybody can catch. One has to maintain the social norms of social distancing, especially the high-risk people have to wear masks, especially in crowded places. So these are the couple of general things that we have.
And that's
that will
enough.
protect
That's enough.
against
I think I've heard a lot of people, and they're saying there's no need to go overboard with your precautions as well. Dr. Gilada, over to you. 20 seconds to you as well.
There's a Kabir, you are Kabir, so there's a Kabir का दोहा, दुख में सुमिरन सब करे, सुख में करे न कोई, जो सुख में सुमिरन करे तो दुख काहे को है. So whenever such disease come, we think of immunity. Otherwise, we are silent. We are not looking at ourselves. We are not giving up habits of smoking. We are not doing exercises. And our cultural practices, namaste. Don't shake hand. Keep a distance. Keep your shoes and everything outside. If you're coming from outside, if somebody's having cough, just put mask.
Basically,
So
pull your socks on basic hygiene and etiquettes. That's it, right? And that's
nothing
all.
more is required. Nothing more is required.
All right.